This is an amazing, groundbreaking, radical piece of work, and I hope it's going to be a very exciting journey over the next few months. As Michael said, I think most of you are mainly anxious about how you're going to spend 165 million, but I really want to emphasise that point, that spending that money is relatively easy. It's the other bit that's the challenge. It's getting the systems to change what they do. I think you're all committed already to early intervention and prevention, you're all committed to evidence and to science, but that really is the easy bit, is being able to persuade your colleagues to change what they do, to change how they spend their money, to do different things, is the prize. And to do that you do need a governance arrangement. It's through having the governance arrangement that you're more likely to get the system change that we're talking about. So I'm going to tell you a story about why we believe that's important. We have, drawing on your point at the back there, we do have evidence as to why a governance arrangement is necessary. So as Michael mentioned, we had the privilege of working in Birmingham quite a few years ago. It was the era of Every Child Matters, when it was all about outcomes. We did a lot of the things that we're doing with you. It was the early incarnation. We had a fantastic visionary director of children's services, Tony Howell, and he wanted to have an outcome-focused strategy for children's services. He wanted that to be grounded in data about the well-being of Birmingham's children. And so we did the surveys that we're doing with you. We actually did one of the school children as well. We reviewed their policies, we mapped how they spent their money, and we brought together the leaders of their local services, so the Director of Children's Services, the ADs, head teachers, the leader of CAMS, chief executive of primary care trusts, 50 different people who had control over money in Birmingham, and we brought them together for 6 days. We locked them in a room for 6 days to understand their data, to understand how they were spending their money, and to come up with a strategy for how they would spend their money differently. This wasn't to attract new funds, this was to think about how they spent their current funds. And they produced a strategy, and they got masses of commitment from people across Birmingham. They also managed to secure an investor-save investment for £46 million on the back of that. But if you think about how much they spent in Birmingham on children, they spent £1.3 billion on children. So whilst it was fantastic to get a £46 million investment, it really was a drop in the ocean compared to how much they spent every year. So those bits were quite easy, getting the data, locking people in a room for 6 days, getting a common strategy, having lots of publicity about it, getting the money. The two things that were phenomenally hard were getting people to stop doing the things that they've always done, decommissioning or disinvesting from activity, and what was the other thing we found it hard for them to do? Sorry. Yes, and retaining the momentum. So we had some fantastic individuals who came around the table for this process. Like I said, the Director of Children's Services, he was visionary, he led this work. He had 2 fabulous ADs who were also brilliant and led the work. But we went back to Birmingham a couple of years ago just to see who was still in the city. So out of those 50 people who we brought around the table, some of you know the answer to this, so don't answer if you've heard me give you this story before. 50 people around the table, 6 years later, how many of those still worked in Birmingham? How many do you think? Have a guess. 10. 10?
Yes.
Less than 10?
About 4 or 5.
Well, actually it was 13. But out of 50, 37 within 5 years had left Birmingham. So the 2 mistakes we made when we were doing that original work was we tied it too much to individuals rather than their roles. So it was too much about Tony Howell and Cheryl Hopkins. It wasn't enough about the Director of Children's Services and the AD. And we didn't have a robust enough governance arrangement that meant that people had to stop doing things and use the new money as a sort of catalyst for disinvesting and decommissioning old work. And these 2 issues, I guarantee, will challenge you as you put your submissions together and if you do progress, either with lottery money or without. So the governance arrangement has got to address those 2 issues. the role rather than the individual, and the commitment to change what people do. So, as Mike has mentioned already, the governance arrangement has obviously got to make sure that you spend the money properly, you don't do anything illegal with it. That's one of the basic functions of your governance arrangement. The second is that it needs to be accountable for activities, and this links to this point about high quality implementation. If, for example, you commit to deliver the Family Nurse Partnership, and I'm not saying you should, but it's kind of quite likely that quite a few sites might choose to do that, and you say you're going to deliver X number of slots to Y types of families, you need to have some group of individuals, your governance, that is keeping an eye on that is making sure that it is the mums who are under 18 and pregnant for the first time and recruited onto the programme before the 28th week of pregnancy that gets this intervention that you're investing in. And that if you say you're going to serve 10 mums per month, you're going to bring them onto the programme, that you actually do that. Too often, all the energy goes into getting the money, and then you kind of maybe take your eye off the ball when it comes to what actually happens with the money. So your governance arrangement needs to be accountable for what is actually done with the money, as well as making sure it's spent legally. So that's accountability for activities. Your governance arrangement needs to be accountable for the outcomes. And this sounds so motherhood and apple pie. We had it a lot when we were in the world of Every Child Matters. But genuine accountability for outcomes is a real tall order. Going back to Birmingham, we found out that the levels of conduct disorder in the city were a good 5% higher than we would have expected for a city like that. So the city committed to try and make a reduction in overall levels of conduct disorder across the city. That's a big undertaking. So we asked that they held themselves to be accountable for that. Now that was a bit of a step too far because elected members didn't want targets specifically related to a difficulty like conduct disorder. But if you're getting this level of investment and you're going to make a commitment to changing outcomes, it has to be very concrete that you're going to make an actual impact on outcomes for a community or for an area. So you want your governance arrangement to be actually accountable for that and to be able to adjust course if you're not making the impact. We've talked a lot about this already. Your governance arrangement needs to be able to bring about system change. So you need to think about who are the individuals that must be around the table and part of that structure who have control over the money and who have the ability to change what's done. So in the guidance you might have read already, we talk about getting the chief executive involved in your governance arrangements from the local authority. So people who are that senior who have control over the money. And this is, I'm sure, some of the conversations you've been having about who should be part of your governance arrangement. But in our experience, where chief executives have an interest and an involvement, we seem to have had far more of an impact than when it's not really on the radar of the chief executive of the local authority. So it's something I would imagine that you're all considering or have considered or bottomed out already. Who else who is senior across children's services, in education, in health, should be sitting on your governance arrangement? So we've touched already on community engagement and how you can have meaningful community participation in the governance arrangement. In the documentation you might have read, we suggest two ways of doing this. And I'm going to come back to this in a minute, but you can either have meaningful community participation on your overall governance, you might call it your area partnership, or you might opt to set up a separate arrangement for community that links to your area partnership. And this comes on to my next point about whether things are core and whether they're adaptable. So, this, as you can see, is a bicycle that has been adapted to carry with it. I think there's 4 children in there. The core feature of the bicycle is it's got wheels, it's got pedals, it's got a saddle, and you can steer it. And this has been adapted to be able to carry children, but the core features of the bicycle are still there. And it's the same with the methods we're talking to you about. We're trying to be clear with you that there are core elements around the governance arrangement, around the fund mapping, around the wellbeing data that are critical, that we think are essential, and there's quite a lot that's adaptable. So the point about community partnership and community engagement is the adaptable bit. This is where you have knowledge and intelligence about your local circumstances and where your communities are at to know what's going to be the most appropriate arrangement for meaningful community engagement. But community engagement isn't just about telling people what's happening. It really is about having community represented appropriately, sitting around the table, having contribution to the decisions, sharing the accountability for the outcomes. So we will encourage you to use your creativity and imagination and experience to design that way of doing it. We can't prescribe, which is why we've written this guidance in such a way that it gives you guidance but doesn't prescribe, and for you to then decide what's the most appropriate way of giving shared accountability to community. I hope we're walking the line between giving you strong guidance about what's essential and showing you where we would encourage you to use your creativity. To give you an example, we've been working in Perth and Kinross using pretty much this method, but not just focused on 0 to 3s. We're working 0 through to 18. And it was very important to them that they had a focus on community. So we've been gathering data about the wellbeing of all the children in Perth and Kinross, but we've got extra data about North Perth, which is one community. We've mapped expenditure across all services for the whole of Perth and Kinross, but we're also looking at how money is spent in particular in North Perth. It's really important to them that community engagement is more than just some meetings where community gets invited along. So we've got a governance arrangement where there's an area partnership which the Chief Executive sits on, which has the Director of Children's Services, head teachers, but we also have a community partnership which has got local head teachers, health visitors, and 50% of the membership is local residents. And it's very powerful when you have residents in the room. I shared data with them about alcohol consumption in their community and at what age young people in their community were starting to drink alcohol. And their reaction to that data was very different from when we shared it with the professionals at the area partnership. And their reaction to what should be done about it and what public money should be spent on was very different. So it's that sort of engagement that we want you to facilitate in your work, giving community a genuine opportunity to understand the data, understand how money is spent, and contribute to this proposition, this strategy. So those are your two options when it comes to community partnership. You can have something that stands alone and feeds in some appropriate fashion into your area partnership, or you can design something where your senior people are together and you have a mechanism for involving community at that level without some separate arrangement. This is the horrible diagram that Perth and Kinross put together to show how the governance that they've developed for this project fits into their wider governance arrangements and how the community partnership relates. It's horrid, isn't it? I mean, Perth and Kinross is not a big place. You can imagine that some of these meetings people see each other again and again. But their early years project board feeds into their area-wide partnership, and that lies at the heart of what they do. They wanted a separate arrangement for community, but there are still formal ways that feeds into their overall arrangements for how they make decisions in Perth and Kinross. I'm not saying this is how you should do it, I'm just giving you an example of one area and how they've done it. So the priority right now is for you to design, or if you have designed your governance arrangements, just make sure they meet those basic criteria about having the right people, that it's not about the individuals, it's about the roles, that it's people who can control the money, that they are going to enable community to be meaningfully involved, and think about these workshops that we're planning with you for November, December time, because those people need to be around the table then for those workshops. Those people who are part of your governance arrangement need to be willing to come together for those 2 days and engage with all these outputs that we're producing with you.